It's Your Health is sponsored by Happy Family Brands. Happy Families Love My Veggies. Pouches contain one full serving of nutritious organic veggies and deliver essential nutrients, including vitamin A, vitamin C, iron, and magnesium to help nourish growing toddlers' minds and bodies. For more information, please visit happyfamilybrands.com. Hi, I'm Lisa Davis, and I'm so glad to have Dr. Gary Horndeski on the program. He is the creator of the Horndeski Method. It was formerly referred to as the Ultimate Breast Lift Reduction. It's an innovative procedure developed by Dr. Horndeski. It revolutionizes the way breast lift reduction and augmentation surgeries are performed. Dr. Horndeski, so glad to have you on It's Your Health. Dr. Horndeski, I just mentioned a little bit about the procedure. Can you tell us a bit more detail?
Horndeski Method is a new procedure. Well, and I actually knew I've been doing it for about 15 years. It developed in about the year 2000. And it's a procedure designed to reshape a woman's breast and elevate the breast higher in the chest wall. This is all done to correct the effect of aging and pregnancies. The whole goal is to create a beautiful breast. And we've been doing this now for about 15 years, and it's very successful. One of the great advantages of this technique is that there's no vertical scar, and the result is permanent in the sense that the weight is now transferred to the underlying muscle. So instead of the skin holding up the breast, the muscle holds up the breast. And this is a whole new principle of surgery.
Are there other surgeons that are utilizing the Horndeski Method?
Not yet, but there will be in the future. We're trying to establish a training program for others.
I watched the video on your site, and it was so interesting to see the way the Horndeski Method differs from the traditional method of doing a breast lift or a breast reduction. Are there any differences in terms of recovery times?
No, not really. It's the same amount of surgery. It takes a little bit longer. Now, we do place the tissue within the muscle, so the muscle actually holds it up. So that leads to some more muscle pain, but that resolves in time too. But the real advantage of the technique is that by transferring the weight of the breast to the muscle, this immediately relieves neck and shoulder back pain associated with large breasts. So this allows a woman who has a relatively large breast to keep the large breast and not undergo excessive reduction to eliminate pain, because the insurance industry believes the only way to relieve neck, shoulder, back pain from large breasts is by massive resections. You have to take a large amount of breast tissue out, usually about 500 grams minimum, which is about a pound. But with the Horndeski Method, it's possible to leave relatively large breasts, which are proportional to the woman's size. And many women, other women, besides breast reduction, other women want lifts. And this is a problem that women experience as they age and after pregnancies. The breast is now lower on the chest wall, and they want it back to where it used to be. The complaint I get most frequently from women, they'll say to me, "Doctor, I don't want my breasts bigger. I don't want them smaller. I want them back where they used to be." And that's really my most common patient, and that's what they want.
What I love is that it sounds like you don't need to necessarily have an implant when you use a Horndeski Method, whereas if you're not using it, they usually recommend an implant when you have a breast lift in order to get that upper breast fullness.
Yeah, the traditional techniques require implants to create upper breast fullness. The tremendous advantage of my technique is you do not need implants for upper fullness. The fullness can be achieved by the procedure, not by implants. So I don't require implants, and the patients don't want them anyway. I mean, the whole idea of implantation is for people who have small breasts. And a lot of times you use implants on people who have large breasts, and then they end up with large low breasts instead of just low breasts because the implant descends. So the advantage of the Horndeski technique is it's all your own tissue. There's no implant. There's no vertical scar. We maintain nipple sensitivity and the ability to breastfeed, which is essential for young women, because a lot of young women, even before having children, have large breasts, and they don't want the damage to the breast that the traditional techniques do.
That is so great that you can still breastfeed. Talk to us about recovery times after the Horndeski Method.
Sure. The recovery is the same as other procedures performed. Usually people take about a week. That's pretty much an average thing. Other people go back in a few days, so it depends. Now, if you have a desk job, many women are either they're at home with their children, or they have a desk job with information processing or computer work, and they can go back in a few days if they're up to it. So I leave it up to the patient. However, we do require them to wear an underwear bra for about 2 months to help form the shape, and that's essential.
Tell us a little bit more about how, with the Horndeski Method, you actually, when you lift the breast, it attaches to the muscle, which again is going to help you with neck and back pain, but also give the breast a fuller look up top.
Sure. Well, the the typical technique depends on the external skin envelope to hold up the breast. Well, if the external skin envelope could hold up the breast, it wouldn't need surgery in the first place. So obviously it doesn't work. The mass of the breast is exposed to the force of gravity, and you must create a force to oppose it. So what part of the body generates force? Well, muscle, of course, generates forces. So the whole concept is your breast sits right on top of a muscle called your pectoralis major muscle. So why not use your pectoralis major muscle to hold up your breast? And that's the whole concept of what I do. So I use the excess skin from the bottom half of the breast, and I use that to make basically straps out of that, which I weave in and out the muscle, so the muscle provides active lift as opposed to passive stretch of the skin. In the 15 years I've been doing it, I've never had to redo one because of descent. So this is biomechanically the strongest breast lift or reduction that's out there today. Many women look online and find the traditional technique, and when they see those pictures, it's a deal breaker because that ugly vertical scar. They'll look at that and say, I need my breast lifted, but that vertical scar is so disfiguring that they do nothing rather than do that. Now, finally, women have an alternative. They can have their breasts lifted or reduced without the ugly vertical scar, and without implants, and without compromise to their nipple, and without compromise to the breastfeeding. So this is a new alternative that women have that I think will give them the opportunity to get the surgery they've been putting off or avoiding because of the poor results of the previous techniques.
How do the scars differ with the Horndeski method?
Sure. The whole point of plastic surgery is to hide the scars.
Mm-hmm.
So where can you hide the scars on the breast? Well, when people undergo breast augmentation, they hide the scars by putting them around their areola or in the shadow of the breast near the inframammary fold. So the Horndeski method uses the same principle. We hide the incision around the areola skin junction because that's a color change and it's hidden well there, and we hide it in the inframammary fold. So just as women accept breast augmentations with hidden scars, they accept this because the scars are hidden as well. So it's very similar to the breast augmentation concept of hidden scars.
Dr. Horndeski, how did you come up with the Horndeski method? I mean, it really sounds revolutionary.
Well, I trained here in Houston, and after I completed my training, I was actually a fellow at MD Anderson, and we did a lot of reconstructive surgery on breast. And when I began my practice, I said to myself, I just can't do that operation. The typical ankle operation was developed in 1956. And here it is, 2015, and still the 1956 operation is the most frequently performed. And I couldn't do that to patients. I said, I've got to come up with something better. And my background is in math, physics, and engineering, which I studied prior to studying medicine. So I applied the principles of engineering to medicine and was able to find a solution. So the way engineers solve problems, they make a model, write the equations for the model, solve the equation, solve the model, solve the problem. And rather than doing the typical plastic surgical memorization of an empirical technique and just doing the same thing over and over again, I decided to solve the problem as an engineer would, biomechanically.
Do you have women coming in for the procedure from different parts of the country and different parts of the world?
Yes, we've had people from 6 out of 7 continents, probably about 3 out of the 50 states so far. So we see people all over the world. And I think it's going to really revolutionize the way breast lifts and breast reductions are going to be done in the future.
Now, does your office help them set up getting a hotel room? How does that work?
What they do, we have a fly-in program. We have a relationship with a hotel. They also provide some taxi services. They have a discounted rate. If a patient comes by themselves, then they need a sitter the first night. But if they come with a significant other, they take care of them the first night, make sure they're okay. But generally, people typically would fly in on a Monday morning. We do surgery Tuesday. I'd see them Wednesday and Friday, and often by Saturday, Sunday, they're ready to go back home again. So less than a week with us, usually.
Dr. Horndeski, it's been so wonderful having you on It's Your Health. Tell us how we can learn more about you and your wonderful work.
Well, the best way to find out about us is to go to the Horndeski Method website and just go online and find that. And we're also very visible on Google and Real Self. They refer to us all the time. So we're on the net, and that's really where people find us most. Now, people shop on the net.
Dr. Horndeski, it's been such a pleasure having you on It's Your Health. I'd love to have you back again. Take care, and thanks so much.
Thank you for having me.